All right, welcome back. So I promised you in the previous videos that I did on this topic, which is, can movies be bad for us? And I showed you how by suggestion they can install unconscious beliefs, they can install unconscious behaviors, acceptance of new trends, sell us product that we may not want or care about, but because of the suggestions that go into our, what we call our subconscious or unconscious mind, we have a feeling of familiarity and then we go buy the products. And also I showed you how movies can desensitize us to things that initially should make us feel bad or at least very uncomfortable, to the point where we don't care because we've seen it so much we don't have a reaction. I showed you how movies also can install changes, behavioral changes at the societal levels, can introduce new ideas from something as simple as food, products, fashion, cars, gadgets. Ideas implemented in the social fabric could be political ideas, economic, social constructs, and so on and so forth. So this we discussed already. But now I want to give you something very practical that you can do, which works wonders. It can work in several ways, but one way is, for instance, if your child has nightmares, which can happen, and then the child gets very scared, starts screaming, the sleep is being disturbed, then of course consequences for the next day, and so on and so forth. And you want to help your child. Another situation where you can use this, example for bedwetting. It works very well with children up to the age of 7, when they begin to have what we call that critical faculty. Usually a question that I get is how young? Well, it depends the level of where the child understands your instructions. So the child has to be able to understand what you're saying and what instructions you're giving them. And here this process actually comes from a incredible hypnotherapist, doctor, medical doctor, that about 50, 60 years ago was still phenomenally well known. His name is Dave Elman. And so he realized, being also a medical doctor, he realized that actually hypnosis can be used very successfully, as I said, with young children and also with adults. He had devised a special method of hypnosis, which I teach in the NLP Master Practitioner. Very, very useful, especially if you want to use it as an adult for self-hypnosis. But let's talk about children first. So how would you use a very simple method to suggest to the child's little unconscious mind that is not okay to wet the bed, but it has to wake up when the bladder is full, wake up, go safely to the bathroom, relieve, yourself in the bathroom, and then come back to the bedroom, go back to sleep and sleep well until the morning. So this will be what you want to happen instead of, the accidents happening over and over and over again. So what Dave Elman says is that you wait for the child to go to sleep and be deeply asleep. Now, how would you know if the child's deeply asleep? Dave Elman was a very practical person and also a brilliant scientist. He was a medical doctor. So he said, simply count the respirations of the child and make sure that the breathing is nice and slow, which is a sign of deep trance, maybe 7 or 8 times per minute. So you need to really look at your watch and make sure it's 7 or 8 times a minute. So when he says 6 or 7, it's even better, right? If the sleep's too shallow and it's not deep sleep, it's better to wait, and it's wise to wait until the child's soundly asleep. And then you approach the child very, very gently. The aim is to very quietly, the aim is to bypass the critical faculty and not to wake the child up. But then you say, this is your mom or your dad or whatever, you function, your grandmother or your nana or whatever who you are, And you say, you can hear me, but you can't wake up. You can hear me, but you can't wake up. You can hear me, but you can't wake up. And you say this very quietly. I'm speaking normally because I want you guys to hear what I'm saying. but you're very quiet, soft, very softly. And you may say this, you may have to be patient and say this several times. So your child will be in a deep sleep. And is a deep sleep is probably you have to repeat this several times. You have to repeat this several times. And then after you say it several times, don't be in a rush. Speak slowly and softly. This is your mom, and you can hear me, but you can't wake up. You can hear me, but you can't wake up. You can hear me, but you can't wake up. And you repeat it several times more, yeah? But I'm demonstrating to you the tonality of the voice and the speed. Speak slowly and very softly. Now, then you say, I know that you are hearing me. So you still address the child, yeah? I know that you're hearing me when your thumb or forefinger, which one's out of the blanket, yeah, which is more available, when your thumb, which I'm going to touch, begins to rise up. So let's say it's this one. You touch very gently like this. Don't be like that because you're going to wake up the child, yeah? Very gently touch it. And you say, I know you're hearing me when your thumb moves. I know you're hearing me when your thumb, which I'm going to touch, begins to rise up. I know you're hearing me when your thumb moves. And you touch very gently, yeah? And you keep repeating, you can hear me, but you can't wake up. You can hear me, but you can't wake up. Or you can hear me, but you stay deeply asleep, okay? And touch the thumb. And then at some point, believe it or not, you're going to see a slight twitch or a tiny little movement like this. The thumb comes up. Yeah. And then you know that you established communication directly with the child's unconscious mind. Can you believe it? It's amazing. But it's how it works. So once you notice that movement, then you give the suggestions. Now, what would be the suggestions? I just said them before, but I'm going to say it again. You know when your bladder is full, you wake up and safely walk to the bathroom and pee in the toilet, after which you return safely. I like to put the word safely there, so yeah. Safely to bed, and go back in bed and fall deeply asleep, and you sleep very deeply until the morning when you wake up happy and refreshed and full of energy. Now, you may have to repeat this several times. In fact, it's advisable to repeat the suggestion several times. This is all, by the way, it's not a big deal. And then you're finished giving the suggestions, then you will say, now I'm going to stop talking to you. And when I stop talking to you, you'll revert to the state you were in before I started talking to you. You'll sleep deeply, and in the morning you'll awaken completely refreshed, and you won't even remember I've been talking to you. But you'll feel great for having gone to the bathroom and coming back to bed and sleeping soundly. And now I'm going to stop talking, go to sleep. Sleep soundly, and I'll see you in the morning. I'll stop talking now. Okay, so that's pretty much all you have to do. Now, if you're a hypnotherapist, it's even better because you are already trained. But I taught this to parents, and they did it exactly. By the way, don't make up your stuff. Use my words, word for word. Don't make up your own words. You need to be careful. If you are not trained in NLP to know how to use words correctly, be careful. Every word you say constitutes a suggestion to your child's unconscious mind. So be careful which words are you using. If you simply use my words that I just demonstrated to you one moment ago, then you're pretty much safe and correct. This example comes directly from Dave Elman. And I got so much feedback, positive feedback, from parents that use this for all sorts of things. Behavioral change with children, up to the age of 7. By the way, I'm not a medical doctor. You understand this. I'm not a medical doctor. I don't advise you to use this instead of medical advice. In fact, if your child has any behavioral problems, you have to consult a licensed medical practitioner. And I advise you strongly to do so. But this is something you can do maybe to help a little bit. Based on the feedback as I received from the parents, as I said, it works very, very well, and it's very useful. I hope this helps. Let me know how it goes. And if you want to learn it, let me know. I will teach you everything I know. Be well, my friends.